facial rejuvenation treatment today on one of my patients who has acne and acne scars. What we're doing first is the area of pigmentation and scarring. We're doing Fractora, deep microneedling, and for her skin type we're doing a coated needle so I can go much stronger and also so she can have a little less downtime as well as less risk to her pigmentation. Anywhere she has some scars or pigment, it's going to do a few pulses. Perfect. You see we did a patch over here, turn all the way to the left. This area is cleared up a little bit more with previous TCA crosses. Eventually we're going to do stronger laser or even punch out some of the scars, but she's a busy working woman, so we're doing a treatment for her that has less downtime. And you can see this Fractora has needles inside, 24 coated needles, and these needles pulse energy into the skin very deep. And that allows remodeling of the tissue to improve scars, texture, pores, and even wrinkles. You can even get tightening with this device. But our focus today is a spot treatment to her scarring area.
Can this help with dark spots also?
Yeah, it does actually. That's why I'm kind of going over a few spots where she has some pigmentation, because all her skincare that she'll do afterwards will really help that area. It also improves acne. So here she has a little bit of active acne, but we're going to combine Clear and Brilliant with this too, so she's going to get a lot more improvement with that. So that's really what we're going to do with the Fractora today, spot treatment. Now we're going to switch over to the Clear and Brilliant. We can keep it on, same, we'll just rotate. So we're going to bring over the other device, and on top of the skin, we're now going to give her a little fan to hold, because the Clear and Brilliant, which basically treats pigmentation, acne, pores, and fine lines, works actually best when you have a little dehydration on the skin. So the fan dehydrates the skin, gets it ready, and now right on top, we do this treatment. Now, if you come really close, you kind of hear like popcorn. Do you hear that?
Mm-hmm.
So that popcorn is the superficial wavelength of this laser, and it's allowing it to go on the surface. Some people call this like a cat's lick type treatment. They feel like it's like a little bit of electrical shock or steel wool brush. How does it feel?
It feels exactly like a cat's
Like a cat's lick, yeah. I mean a cat's tongue. I've always wondered what a giraffe's tongue felt like. Have you ever seen a giraffe's tongue? I see them on Instagram all the time, people feeding a giraffe, and it's like a huge dark tongue. And cats, like you look at it and they're cute and little, and then all of a sudden they're like spiky tongues. It's crazy. So I once had a patient, she's so cute, from Minnesota, and every time I come, she's like, it's like a cat's lick. And I go, oh my God, that's right. I never thought about that. So now we always say cat's lick and everyone agrees. So, but it's not that painful, because cat's licks typically are not that painful. But we're going over numerous passes, and every time we do, little baby holes come into the skin and it causes like an exfoliation. But the exfoliation from this laser is so light, it's more like sandpaper-like texture, right? You've had this before. And we like to exfoliate that though, because it gives you a better result for both acne and pigment. So it's really important to be using a retinol, glycolic, hydroquinone, and or acne treatments immediately after treatment. Some people will wait 72 hours if their skin gets a little more sensitive. If not, you can start it. And we can go right over where we did the Fractora. Is anyone saying anything?
Just saying that was a good Midwestern cat.
What did you say?
That was a good Midwestern cat.
Oh yeah, who is? Wait,
No, the
oh, she was like,
yeah.
It's like a cat's lick. It's true. I'm from Chicago. I'm allowed to say that. So Chicago.
Yeah.
Mm-hmm.
There it is.
I know, it's so true. So we go back and forth over a few passes, and you can see it just gets slightly red. And then over the next 3-4 days, she'll feel like a texture on the skin, but it shouldn't restrict her from her everyday life, which is why it's a very good treatment for her, because she's a busy bee. Turn to the left a little bit. You know, so this is the treatment I say is like the laser facial for people. This is what young people should be doing. preventative anti-aging, pigmentation, acne. You can see where I did the Fractora, she has a little bit more swelling there. That's called an urticarial reaction. That's a good thing. That's deep tissue heating. That's remodeling of the skin that will occur over the 6 to 12 weeks moving forward because of collagen production. And for now, this Clear and Brilliant will work on the surface.
What does it mean when you have a breakout and it leaves like a dark red,
Oh,
dark purple
I
mark?
feel so bad for people that get that because she gets that. It's some people's skin tone. It's inflammation. When you have inflammation in the skin, whether it be a fall and a cut, or you scratch, or pick, or an acne bump forms and it's just swollen, you can get pigmentation, or what's called post-inflammatory pigmentation, or PIH. That is the bane of my existence because all I do all day is treat pigment. If she had downtime, she could do a Cosmolon peel and get an amazing result in pigmentation. A little less downtime, she could do an Enlighten peel, but she'll be red and lightly flaky for about a week. A little closer downtime to that would be a Rev peel, which she's done before and it did amazing right before her wedding, which also removes some pigmentation and acne. Otherwise, you have to do things like this: laser genesis, aerolaze, which are microsecond YAG lasers, Clear and Brilliant to have minimal downtime, and do a lot of lightening creams. One of the things she should be doing is using hydroquinone or retinol at nighttime, acne medicines like glycolics, and exfoliating enzymes like papaya during the day and at night to help. That if you keep getting the acne, you can keep getting the pigment. So one of our key talks today was, let's get rid of this acne, whether it be with a pill called spironolactone, starting regular facials and laser genesis, or doing Accutane. There's a lot of options there. So we are going to make that decision for her very soon, and we will see, because I want her, she's working, she's busy, she takes good care of herself. I really want her to not have to worry about this pigmentation and acne anymore.
Much appreciated.
Yes, exactly. Exactly, we've been fighting this for too long. Okay, turn all the way to the right.
If you don't numb for Fractora, does it hurt?
It does. It's very painful even with the numbing. Jenny's like one of the strongest persons I know, if you can tell. She's super fit and has a great mental personality, so she can be best mentally prepared. But if you easily have pain, Fractora is not the best treatment for you unless you're ready and motivated for it. It does very well, it just hurts. It's deep needling. Remember, guys, it's not that the treatment itself, it's the heat that's being generated under the skin when the needles go in. But we need the results, so just like a no pain, no gain, it's the price of beauty. But it works and it helps her because she has very minimal downtime. So overall, we're doing something that will give her a nice improvement, at least to her skin.
Someone said, I'm ready.
I'm ready. Come on in. Let's do it. We do so many Fractoras, so many lasers. We're doing lots of research on the newest treatments all the time. I feel very lucky. We have patients that trust us. We love our patients. It's about a long-term relationship in this industry. Especially when your face is so important to you. You want to make sure you go to an expert that understands these combinations, that knows how to do unique approaches. She has a very specific, sensitive skin type. The average person that isn't laser fellowship trained or knows very detailed skincare protocols is probably going to put her at risk for hyperpigmentation and permanent scarring given her sensitive skin tone. So, when I was in my fellowship in San Francisco, 3/4 of my patients were Asian. Asian skin type needs to be treated totally different than, like me, the Midwest white guy. That's what I used to say. And when I did my training in New York at Mount Sinai, 3/4 of my patients were Black and Latino and mixed ethnicities, mixed Hispanic. That's also another unique skin type in treating, especially clogged hair follicles, pigmentation, pores, and scars. So you really got to make sure you go to somebody. Nobody's perfect. Nobody's the best at everything, but you want to go to somebody that you trust in case something does go wrong. They're there for you to take care of you. We're pretty much done with the clear and brilliant. So you can see just a light redness, mild swelling. Take a look. You can see just mild redness. And then what's going to happen is that cat slick is going to turn into a mild sort of exfoliating sandpaper-like texture over the next couple days. And then her skin will look bright. And it'll be nice because a lot of times this does slow down or stop the acne breakouts for a short time period. And that will give us some time to decide on Accutane. We'll start with spironolactone. It'll be great. And I'm going to put her under a red light right after we're done with this, because not only will it help prevent any issues with her nose filler that we just did, decrease any swelling from the lip filler that we just did, but also improve the swelling from the laser, because she wants to walk out of here looking pretty good and not like a lobster. All right? Have a good rest of the day, guys. Again, it's our first day at our new office, so thank you for following.